I hope everybody can hear me clearly. I'm going to speak for about 20 minutes or so, giving an update on the medical ideas that hopefully there's some good new ones and information that people need to know, and then we'll take some questions afterwards. I would ask that people take this very seriously. I can't stress enough how serious, how much of a medical catastrophe COVID-19 is for our local neighborhood and for healthcare in the United States and healthcare across the world. All of our hospitals in Nassau County had no cases of COVID, zero. There was no COVID in Nassau County 2-3 weeks ago. Today, less than 2 or 3 weeks later, every single hospital in this surrounding area, both in New York City, in major parts of New Jersey, certainly in our area of Nassau County, even out to Suffolk to a lesser extent, is overwhelmed with cases of COVID-19. We went from 0 cases to over 200 cases in our hospital. And the same picture is in every other case. These are admitted patients requiring serious medical intervention, many of them having great difficulty breathing, many of them almost on a ventilator, and many of them on a ventilator. And heaven forbid, we've had deaths, people that were previously very healthy, albeit sometimes older or with some underlying medical problems, who never would have been expected to die, but have died because of COVID-19. This is an extremely serious medical problem. And therefore, everybody needs to know what they have to do to protect themselves from, heaven forbid, getting COVID-19. And the single most important thing that everybody on this call needs to understand, needs to tell their friends, tell their family, needs to publicize, yell at the top of your lungs, is we must do things differently. This Pesach, this Passover, is going to be quite different than any previous Passover. The last couple of Shabbases, when people go to shul every day, multiple times a day, people that go to yeshivas, people that go to schools, life has changed. None of those institutions, the most hallowed institutions of Jewish life, are open right now. None of the wonderful community-based organizations like the Gural JCC, which I want to thank for putting together this wonderful program, and to Ms. Byrne and all of the other organizers for doing such a great community event. None of the institutions in the community are functioning the way they did previously, and every individual in the community has to understand the same thing. It cannot be business as usual. The gyms aren't open anymore, but people can't do things that they were doing previously. You can't invite your friends over for coffee, for supper. You can't get together in the park and have the kids playing on the playgrounds. These are all horrible suggestions at this point in time. COVID-19 spreads by people being nice to each other in a physical sense. It doesn't spread by people being nice to each other in a non-physical sense. And one of the things I want to stress is that while we have to distance ourselves from each other in a physical sense, we have to make sure that we don't distance ourselves in an emotional, and heaven forbid for those alone and singles that are living by themselves, that they don't get isolated. So we have to redouble our efforts on both counts. We have to redouble our efforts to understand that any physical contact with people outside of your immediate family that you're living with is strongly advised against, except under the most extenuating circumstances. People have to go out and shop. You need food, but you don't need clothing. You don't need anything else. That can wait. But if you need to go shopping for food, we need to practice even there very good social distancing. Only one person from a family goes out. They go out and buy a big amount of stuff rather than going out 5 times a week. I'll get milk today, I'll get bread tomorrow. No, get it all at once. Make one trip. Stay away from people in the store. Don't talk to people and congregate with people in the store, even though you normally would love to say hi to them. Wave from a distance and go on, do your shopping, and leave. There shouldn't be lines in the stores. If there are, people have to spread out. The stores are doing their best to try to make deliveries where possible. That's the better idea than going into the stores. Whatever you can order online, order online. Have the stores delivered to you from the neighborhood. We want to support those stores that are still in business in some way. but it can't be business as usual. This is the most difficult thing coming up right before Pesach, before Passover. It's very hard on people not to be able to do all the things that we normally would be doing at this time of the year to prepare. And I want to strongly again mention, we can't let our physical requirements of restriction from social contact carry over into, we don't care about you. We have to redouble our efforts. I think, in a way, God is telling us, I'm giving you a challenge over here. I want you to distance yourself. But he's also saying, I want to make sure that you're taking care of the people less fortunate than you in the neighborhood. Make sure that somebody's checking in through technology, through the telephone. Sometimes just going up to their window and saying, are you okay? Make sure that these people are being checked on. Make sure that their needs are being met. They can't get out, older people especially, and I won't begin to define older. But I fall myself into the category of older, in the sense that people, every decade as you get older, are more at risk, chas v'sholom, heaven forbid. If they were to get illness, they would be much more likely to have a more serious illness. It's not to say younger people don't have to worry about this. And it's not to say that younger people shouldn't be very concerned about spreading such illness. But older people especially, and I'll call 50s and 60s and 70s and up, older people in this regard will be unfortunately affected more severely than people younger than that. And we have to make sure that those people who aren't going out, can't go out, or are afraid to go out, don't maybe have the regular caregivers or aides to help them, that those people aren't forgotten at this point in time. And it's critically important that we make sure that we do both. We physically distance, but we emotionally, mentally, and to take care of the needs of those people, that doesn't get lost. COVID-19 is spread by being in the area around the person who's ill or around the person who is infected, even though they're not ill. One of the reasons why we've had such a difficult time with this illness is because people can be very contagious, even if they're without symptoms. And that's a huge problem. That's why everybody has to isolate. That's why everybody has to stay out, not just the people that were sick. Originally, we were saying, don't go out of your house if you have even a cough. Now we're saying, don't go near other people, even if you're healthy. Now, when I say don't go out of your house, you can go out of your house. You can take a walk. We stress and think it's very healthy for people to go outside, but not to interact with other people. You're taking a walk and somebody, a neighbor or close neighbors across the street, you wave to them. You talk to them from 10, 15, 20 feet away, and then you go on and continue your walk. We can't have those hugs that we normally might do to our friends. We can't, even with our grandchildren, if they're not living in your house. Grandchildren are the greatest gift that God has given us. They can also be, heaven forbid, a tremendously important vector of transmission. And again, older people especially, as difficult as that is, may have to have their Pesach Seder, their Passover meals, by themselves, rather than have the family over. And certainly if the family's from out of the town, from a different area, we're strongly recommending that people not travel to go far away and introduce maybe from one neighborhood to the other neighborhood illness when it's not present in one of the neighborhoods. This is a very serious concern. The normal, wonderful family gatherings that we have on Pesach this year will not occur. They cannot occur. They're, according to Jewish law, not allowed to occur. As much as we want to celebrate Passover all together with our families, that's what we've done for years. People remember with great love and affinity the Passover Seders when they were a child, and they want to give that same experience to their grandchildren, their great-grandchildren. That's not going to be the experience this year. Why is this night different than all the other nights? This year the question is, why is this Passover different than all the other Passovers? And it's because we're going to have to stay with ourselves. We have to only stay the family unit that you have together, with the only exception being if there's somebody that's alone or somebody that cannot make Passover for themselves, and they've been self-quarantined. They haven't introduced any other people into their lives. They're staying by themselves, and they're healthy without symptoms for at least 14 days before Passover. We will allow one family to mix with another family that's where they either can't make Passover or somebody would be alone. It's unthinkable to think of somebody spending, if they're observant, the 3 days of Passover without leaving their house without using technology, without being able to be in touch with anyone. So in that situation, assuming everyone is healthy, that one alone person can go in with another family. That one child, if their family is not having medical problems, they haven't had symptoms, they can move in maybe with their parents, grandparents, but only in that situation where they've all been healthy and they've been self-quarantining for the 2 weeks before Passover. There are a lot of new things that we're learning every day about COVID-19. Some of them, we're learning more about the way the disease is spread. As I said, it's in the air around the person. When they breathe, they cough, they sneeze. It can be landing on the surfaces. So if they're coughing and they touch the doorknob and somebody else then touches the doorknob, that could be a way to transfer it. When the person touches the doorknob, they touch their face, their nose, their mouth. They can then transfer the illness. It's critically important that people wash their hands when they come into contact with these types of public features. Try not to touch your face. You don't have to wash your hands every 10 seconds. Try not to touch your face when you go out shopping. And as soon as you leave the store, you wash your hands. Come back into the house, you wash your hands. People don't have to go crazy. You don't have to wash your hands every 20 seconds. But if you come into contact with something that could present an exposure, so then be aware. Try to prevent the exposure from occurring. That's why we recommend not being within 6 feet, even more is better, of somebody else. To people that have to go to work, they have jobs, they're policemen, they're firemen, they work in the hospital. So then they have to take precautions there as best as possible to stay away from other people. Try not to be in close contact. In the hospital, we wear masks all the time. We're walking into rooms all day with patients that are very sick, very contagious. Everybody has to take the appropriate precautions. In the hospitals, we're sometimes desperate for protective equipment, for personal protective equipment. And I'm not asking for an appeal here, but I think it's very important if people do have, from their work, for whatever the reason that they're not working right now, for example, like dentists, or from construction, or whatever the occupation that you may have, if you have masks, N95 masks, regular surgical masks, if you have gloves, if you have other personal protective equipment, the hospitals are all in need of this as life-saving and as important as they are. We don't always have enough of these pieces of equipment. And certainly I'm sure that the Gural would be very able and willing to be a collection site for that. And I'll be happy to bring them into Mount Sinai, South Nassau, other hospitals as well. We're in need. We're getting donations from people. We're very appreciative of that. And that's something that people can do. It's also critically important to realize that there are therapies coming out. And we'll probably announce later this week, Mount Sinai, South Nassau, and the Mount Sinai system, as well as other hospital systems as well, are going to be initiating drives to test people who have recovered from COVID, and they will be able to hopefully donate blood, and we can check to see if they have high titers, which means that they have a large amount of immunity to COVID. And then we can talk about getting those people with the highest units of protection in their blood to donate their antibodies, which would be perfectly safe for them. And then those antibodies can be used and given to patients who are very sick. This is a brand new technology. We just started this at Mount Sinai this week. We're the first hospital, I think, in the country to do that. Another hospital in Houston, I heard, is starting it. Other local New York hospitals are working on it as well. And this is very promising. Some very preliminary studies show that this might be helpful. And that's another way that everybody can do something to make this less of a plague. We have the 10 plagues. There's a saying from the rabbis that with all the plagues, there was also pestilence. Pestilence, infection, came along with every plague. And I think, unfortunately, COVID-19 is reminding us what happened in Mitzrayim, in Egypt, years ago, when our forefathers left Egypt. There was pestilence there. There was a strong makkah, a very strong plague that God gave. And it affects every aspect of life. People have lost their jobs. People are out of work. People are suffering in ways other than just the physical illness that COVID can cause. And our community will rally around, and wonderful agencies like the Gural are already doing so much, and local temples are doing so much to help the people in need. So there are a number of things that we can do. I've outlined, hopefully, things that we can do, but the most important one is to pray. We sometimes take that for granted. But prayer, Jewish people, we pray. We pray for ourselves. We pray for our families. We pray for our community. We pray for the Jewish world. We pray for the non-Jewish world. We pray for everyone because we understand the tremendous power of our prayer. And this is a time, especially in this month of Passover, the prayers are heard better, so to say. And that's something that everybody has to make part of their daily life, to pray. So we need to increase our chesed. We need to increase our charity in terms of looking for other people who are suffering, making sure we call on them. We're not asking for money, but make sure somebody is contacting those people that are alone, especially since they're not getting out of their house. I know many 80 and 90-year-old people that are terrified to leave their house, and their kids are scared to come to visit them. But somebody needs to make sure that they're okay, knocking on the door and asking, are you okay, without even going inside, calling on the telephone. If it's the holiday and people can't call on the telephone, so then to arrange a time that you can see them, say, go out of your house at 10 o'clock in the morning and wave so we know that you're okay. There are many things that we can do. Chesed, kindness, charity at this time is another great way for us to fight this horrible illness. So there's prayer, there's kindness, there's charity, there's medical things that we can do in terms of donations of equipment, in terms of when these announcements come out, looking for people that are, thank God, convalescing and getting over their COVID, to consider donating a sample of blood to see if they have high immune status and maybe a potential donor and save someone's life. There are things that people can do to prevent others from getting the disease, the social distancing, and making sure everybody's aware of it. If you see people, friends especially, relatives, that are acting in a way that's maybe not taking this as seriously as you should, speak up politely, nicely, and say, hey, that's dangerous. Even if it's people that we normally wouldn't be talking to in a way like that. Children, grandchildren say, no, I can't hug you right now. It's dangerous. And nobody wants to hug their grandchildren any more than any grandparent does. But this isn't the time to do that if they're not living with you. This is how this illness is spread. There are therapies that we're trying in the hospital, experimental drugs, this experimental plasma therapy that I alluded to, other medications that we're trying. There is hope. But at the present time, the best hope is our understanding how the disease is spread and what we each must do to prevent further spread of this disease. The Five Towns community has been hit extremely hard. We have some of the highest numbers in the entire United States. Our numbers per 100,000 are higher than New York City, higher than New Jersey. We're in some ways an epicenter, a major center of this pandemic. And we do have some control over who else will get this. So I thank you very much for listening to me. At this point, I'll turn it over back to Ms. Byrne to speak to me with the questions that have come in, and I'll try to answer them in the next few minutes. Thank you very, very much for listening.
Thank you, Dr. Glatt. I have a question from a lady in Rockville Center concerned about her sister who went through a stem cell transplant in the fall. She's suffering from multiple myeloma and is fighting a growth of a tumor that came back. She's on life-sustaining chemo and needs to be in the hospital. Is there any advice you could give her as far as extra precautions to keep her sister safe?
So I'm very sorry for her illness, and I wish that she should have a refuah shlema, a full and complete recovery as possible. Unfortunately, hospitals are not the best place for anybody to be. And a very additional important public health message that I can tell everybody is absolutely do not go to the hospital to get tested for COVID. The hospitals cannot do that, number one. They're overwhelmed, number two, and you're potentially exposing yourself if you don't have COVID. So absolutely only go to the emergency room if you're having difficulty breathing, if you would normally have gone to the emergency room because of the level of sickness that you have. If you're not that sick and you think you may have COVID, Call your doctor up on the telephone. Call up an urgent care center and ask them what you should do. Do not call the emergency room. Do not come to the emergency room. It's actually going to be negative. It will be bad if you go to the emergency room. Most people who have mild disease are going to be told, we don't need to test you. Stay home, drink a lot, eat properly, sleep properly, and hopefully most people get over it on their own, especially if they're younger. But if there's any signs of difficulty breathing or other significant symptoms, by all means, don't hesitate to call your doctor, go to an urgent care center, and if it's severe enough, go to the hospital. In regards to this specific lady with the multiple myeloma, again, I wish her a complete recovery. If she needs to be in the hospital, people shouldn't be afraid to be in the hospital if they need to be there. But it's not the best place to be. And the hospitals are extremely overwhelmed at this point in time. And I ask that people understand if they're not getting the usual great care that they're entitled to and want, if people aren't running to them every time they have some minor difficulty, and to have an understanding that there are literally hundreds of patients in the hospital. It's like the hospital's an ICU. These patients are so sick. The staff are so stressed out. To have an understanding that, yes, your care needs will get taken care of, but it may take a little bit longer, and to please understand that they're putting their lives on the line. They're working much longer shifts. They're working under difficult conditions, and to be compassionate towards them, as they will try to be very compassionate to you.
So we have a number of questions that came into the chat room. The first one is, do you need to wear a mask when you go out to take a walk? I see so many people outside with masks on.
So I would tell you that's absolutely not necessary. If you're taking a walk outside, breathe the nice fresh air. You're not going to catch COVID by walking outside. You will catch it if you start and talk to people and get close with them, because then the wonderful ventilation system that God made for us is going to be breached by somebody blowing in your face or coughing or just breathing in your face. But taking a walk is a wonderful thing to do, and you do not need a mask. And in fact, if you're buying masks and then throwing them away, you're taking them away from healthcare workers who desperately need them. If somebody is going to an area where there are other people around, even there, they probably don't need a mask if they're going and not standing in one place for a long time with one person. If somebody has underlying medical conditions or is older and they have the mask to put on, it doesn't even have to be a regular real mask. It could be almost like a scarf or something that you just cover up, that you're not being directly exposed. That might be okay, but even there, it's not even recommended. We just recommend don't stay out in public any longer than you have to in the setting of other people. Sit on your porch to your heart's content. Go and take walks to your heart's content. That's fine.
The next question, Dr. Glatt, what is the latest news about in-home self-testing of antibodies?
So unfortunately, that is not a reality at this point in time. Abbott just came out with a test that can diagnose corona in 5 to 10 minutes. It's not yet available easily. It will be for hospital usage. They are working on various types of home kits. Now, this would be wonderful. Just like people could do a pregnancy test at home or other tests at home, this would be wonderful to let people know that they do or they don't have it. Obviously, it will depend on the accuracy of the test. It will depend on when you do the test. If you're doing it when you don't have symptoms, so all it means is right now you don't have it, you can have it tomorrow. But if somebody has symptoms that are consistent with COVID, and those symptoms are anything like a cold, just sometimes a cough, sometimes it could be loss of smell or loss of taste, or it could be much more serious, shortness of breath and more significant respiratory symptoms, breathing symptoms. So then a negative test, assuming it's an accurate test, would be very helpful.
Dr. Glatt, a question that is repeated with several other people. What precautions should we take when boxes and food are delivered to your home?
Okay, that's a very good question. I've been asked it a lot. The official CDC position on this is that this is not a significant route or vector of transmission. Everybody has read the studies about how long the virus can survive in different situations. That's by testing. It doesn't mean that it's necessarily contagious in those situations. We sometimes have such sensitive tests that we can detect the virus, but it's not virus that could spread. Having said that, common sense is still the best tool that somebody can have. You bring in all your packages from the outside, you unpack them, you put them away, wash your hands. You come into contact with something that potentially is dirty in some way, don't go prepare the food before you wash your hands. You come out of the bathroom, you wash your hands. Common sense, appropriate. What your mom told you to do about washing your hands is what you should do. And I wouldn't drive oneself crazy. I was asked this today by a reporter. When you come in from the supermarket, you have to wipe down with an alcohol wipe every single thing that you purchased. And the answer is no. But the people that are doing that sometimes are standing online waiting 15 minutes and talking with somebody, and that's how they get the disease, not because they didn't wipe down the cans. So the social distancing we should be extremely strict on. And appropriate hand washing when you take in stuff that you got packages and you open them up and you take them out and you wash your hands, I think is fine.
Okay, if someone only has the symptom of loss of taste and smell, but the symptom goes away after a day or two, is that a valid positive coronavirus?
So it's unknown because COVID-19 can do that, but so can the regular common colds. So it's not by any means proof, but I certainly would assume that such a person had COVID-19 till proven otherwise. So unless they got a test, which was not necessarily recommended, you can't say that they did or did not have COVID-19, but I would certainly treat them as if they had COVID-19 in terms of quarantining them from other family members that they haven't been in contact with, but they should be quarantining anyway. But certainly this would be a push to say, I really need to stay away from other people.
Thank you. If two people in the family have the coronavirus, can they quarantine together?
Absolutely, especially if they got it from each other, because they're exposed already. So we don't think that you can get coronavirus twice or at the same time get a different strain of coronavirus. So while I would never recommend that a partner, infect their spouse, but if they're living together in the same house and then one of them starts to get sick, so obviously whenever one partner in a marriage gets sick, you try to take care of that partner and you try not to get infected from that partner, but you've probably been exposed at that point in time, and I'm not sure it makes any sense to now move to another house or leave the family house because you want to stay away from them. Now that might be different in people that have very severe underlying medical problems. So each case needs to be individualized, discussed with your doctor as to whether it's smart to stay together. But if it's a regular healthy-ish couple of any age and they've been living together in the same house and sleeping in the same bedroom together, and the wife gets sick, the husband shouldn't run away. He should stay in the house and he'll take care of his wife as needed. He's probably been exposed anyway, so there's limited things that he can do. Again, common sense, wash your hands, don't touch the tissues, try to be as careful as possible, but I don't think it makes sense in that situation to run away, again, assuming the person's of moderate good health.
Okay. If you're over the virus, can the person come to a grandparent's house to help for Pesach preparations?
So that's a very good question, and I don't have a very good answer, unfortunately, because the answer is we don't know. There are people that can still be contagious for a period of time after they've cleared the virus. In other words, if they're healthy, they've gotten over their symptoms, whatever symptoms they had, they still may be shedding virus, they still may be contagious. And even if you do some testing, which nobody is recommending because we just don't have the resources to do that testing, they still could be, on occasion, shedding virus. And for that person to assume that they're automatically healthy is a potential risk for the grandparents or the older people that they're going to help out with. They're going with the most wonderful of intentions, but they could unfortunately be transmitting illness. So certainly, I wouldn't suggest that that be done. If it's more than 3 weeks and they were positive, they probably, then statistically speaking, are not shedding virus. But even there's some outliers. We hope to be able to identify and test people for these antibodies and maybe be able to know in a couple of weeks how likely somebody is to still transmit illness if they have these antibodies. But that's information that I can't tell you right now. And I would suggest, whenever in doubt, don't expose the older people. If there's any way that somebody else can go, that would be preferable.
Are there any safe general guidelines to share how long after the symptoms go away can the person go out?
So again, they can go out as long as they're not in contact with anybody else, even when they're sick. Again, we don't suggest that if they're ill enough that they have to be in bed, that they go outside. But somebody that just has a very mild cough, and the spouse was COVID positive, and now they have a cough, so they probably have COVID. But they could go outside and sit on their porch. They could go outside and take a walk, but they should absolutely not go near anybody else. And they should run from somebody else. They shouldn't be near anybody else. That's not the person that I would suggest to talk 6 feet away from you, because it's 6 feet. In that setting, they're still considered contagious. We don't know when they stop being contagious. The official Department of Health recommendation is if it's been 7 days at least from the onset of your symptoms, and you have no longer a fever for at least 3 days, and your symptoms are resolving, even though they may not have fully resolved, you're technically considered a much lower level of contagiousness. But I can't tell somebody that it's 0. And while we'll let such a person work in the hospital, we'll make sure that they wear a mask during the next 7 days as well. So I would in general tell people, for at least the next 7 days, try to stay away from everybody possible, at least for those 7 days.
Dr. Glatt, when coming into a grocery store, should we be changing our clothes after shopping when we enter our home?
I don't think that's necessary. I think that in the normal way that you walk in a grocery store, I don't think you have any real risk of getting contagion, virus, on your clothing. There actually was a study that showed even the personal protective equipment, the gowns and the masks that the doctors, nurses, and respiratory therapists wear in the hospital, in a very simple, small study, actually showed that there was no virus that could be detected on those gowns. So walking in the supermarket with your jacket or blouse or shirt, whatever it is, I don't think you need to change it right when you come home. Again, hand washing is much more important. Remembering not to touch your face, which is easier said than done, is an important thing. And if you're sick, if you have any symptoms, don't go shopping, period. Okay.
I've heard this several times. Is it true Advil, Tylenol, or aspirin can make the virus worse?
So there is absolutely no real evidence to support the idea that any of those drugs make the virus worse. In general, we don't recommend that people take Advil or Tylenol unless there's a reason to. They're good for mild pain, sometimes even more severe pain. They can be good if you have a fever to lower the fever, but they do nothing to make your illness go away. And in general, they should be reserved for people who need them for symptom control, significant pain, even moderate pain, or higher fevers or fevers that make a person uncomfortable. Certainly for children, that's something that's much more important when they get much higher fevers than adults usually do. If a person has significant pain or significant fevers, they need to probably be evaluated as to why they have that. Now, if they have been evaluated and a diagnosis is clear and those medicines have been prescribed, I wouldn't hesitate to use them. There was one report of 4 patients with COVID that seemed to deteriorate, and they noticed that they had taken what we call these non-steroidals, the Advil, Motrin-like drugs. But that hasn't really been corroborated. And the official position of the FDA and the CDC is that there is no reason not to take those medications if they're appropriate to take them. Again, they're not simple medications. They have significant side effects. Tylenol can be a fatal drug. Advil, Motrin can be fatal drugs. Thank God, the vast majority of the time they're not. I don't want to scare people, but I wouldn't want to take any drug if there wasn't a good reason to take it. But if there is a reason to take it, then one shouldn't hesitate to take it if you have COVID.
Dr. Glatt, safe is it to purchase pre-made food or bring in salads?
So the CDC again recommends that this is not a vector of transmission. And I would strongly tell people not to be afraid to order pre-made food and to eat it. It's under probably much better health guidance than stuff that people may prepare in their own kitchen if they're not careful and knowledgeable. The stores have regulations. They're trained in food preparation. Now, that's not to say that nobody's ever gotten sick from store-bought food, and that's not to say that nobody's ever gotten sick from homemade, house-made food. So the normal, important, proper preparation of food must be adhered to. But there's no reason to think that COVID is specifically going to be at a greater risk than any other problem that we've had with food in the past. So I would not consider that a significant risk.
Okay, what about elderberry? Is it helpful, or can it help harm the virus?
So I'm a very big believer in evidence-based medicine. I need to see that something works rather than somebody says, I think that's a good idea. A lot of good ideas in the past have actually harmed patients. And I'm very skeptical about any therapy that isn't proven. Now, at some point, you have to prove it. So I'm a very big fan of scientific studies. And I'm a very big fan of saying, hey, that was an interesting finding that I had. Let's investigate it. I'll never say, nah, don't investigate something. But some of the claims out there are actually potentially harmful in that they can have serious, sometimes, side effects. All these homeopathic therapies and these herbal therapies, they have killed people. There are dangerous herbs. There are things that are sometimes going to interact with either the illness that you have or medicines that you're having. So something is, to me, always proven to be good before I'll use it, or at least thought to be good, have some scientific evidence. I'm very hesitant to try things because somebody says it's a good idea. I'm very happy to investigate it if it's a good idea, but not to blindly give it. And I'll give you an example. The hydroxychloroquine that everybody is touting as being the best treatment for COVID, used with the azithromycin. So that's actually caused shortages of this for patients who desperately need these drugs. And they're actually getting hurt where we're not even sure that anybody's being benefited from the hydroxychloroquine and the azithromycin that are being given to COVID patients. Now, I also prescribe those drugs for some COVID patients, and I do not know what role they have, but there is some evidence to suggest that it may be beneficial. There's evidence to suggest that it's not. So we need to look at this in the scientific light. But for people to take it preventatively, for people to hoard it, that's actually hurting people that need this. This is a major medication in certain types of arthritis. And if those patients don't get it, they're going to have flare-ups and they're going to get sick and they're going to come to the hospital. Azithromycin is the treatment of choice for certain bacterial infections, not COVID infections. And if we have a shortage of that, we can't treat certain bacterial infections, nothing to do with COVID, properly. So people need to understand that medicines that aren't proven, medicines that somebody said, well, this worked for me in this patient, if they're not in a study, I take it very, very much with skepticism.
Dr. Glatt, can you share what it's like in the hospital? What percentage of the patients going into the ER have coronavirus? And what is the hospital's strategy as far as separating the coronavirus patients on the floors?
So the hospitals are overwhelmed. They're swamped. The majority of patients in my hospital are COVID patients who are very sick. The majority, think what I'm saying. 2 weeks ago, we had no COVID patients. 3 weeks ago, no COVID patients. Now, the majority of our, and I believe every hospital, is COVID patients. We've stopped elective procedures, elective surgery. The hospital is drastically different. We've isolated, we've made units of COVID patients. We've made wings of COVID patients. We put up tents. Our construction people at Mount Sinai, South Nassau have done wonders in building new units. We've transferred a conference room into a patient care area that freed up 2 units, which we now have filled with COVID patients. We have normally a nice number of ICU beds. Essentially, the entire hospital has now become an ICU. That's how sick these patients are. The hospital has been dramatically changed. And I'm going to have to ask you to therefore cut it this short because I do have to get back to certain things. So if there's a last question, I'll take it. And I want to just thank you, Kathy, for putting this together.
Thank you, Dr. Glatt. We want to support you in all your efforts, and you really are that community leader that we all look up to. So I think there's a lot of redundant questions, so we'll leave it at this. But again, thank you, and keep up the good work and be safe.
Thank you very much, and I thank you all for listening, and most importantly, I thank you for getting this message out to people that aren't on this this Zoom conference. Thank you for having me.
Thank you, Dr. Glatt. Be well.